My name is Sam Shapiro. I'm here to talk about cognitive behavioral therapy, how it works. Okay. Cognitive behavioral theory, or CBT, as a therapy is how it works. The gist of it is there's the cognition, which is your thought. And the thought leads you to have an emotion. The emotion leads you to have a behavior. So to interrupt this process and change a person's emotions and or behaviors, what we want to do is we want to change how they think about a situation. For instance, if you see something as offensive, but you hadn't really considered all the elements of the situation, then once we get you to consider all the elements of the situation and you no longer feel offended, you will not feel offended. And so you won't then engage in whatever behavior and you engage in after you're feeling offended. Okay. The first thing we want to do with cognitive behavioral therapy, before we engage in this whole process, is we want to assess the person. We understand what's going on with them. That may be a diagnostic assessment, which I would recommend you get done more than just a single meeting. Ask for doing a more thorough diagnostic evaluation. Because if you think you're ADD, but you're really having attention due to anxiety, which you didn't know about, you should be treated for the anxiety, not directly for the ADD. The next thing is, once we've assessed you and know what's going on, then we want to have a reconceptualization. That's where we want to understand things in a different perspective, and that's what I was talking about here, where we change your cognition. Okay? And then we want to do a skills acquisition. That is, we want to teach you ways with skills to change that way of doing things. So if every time you feel like doing X, we can teach you how to do Y instead. People do that with habit breaking too. Like if you're always engaged in a particular habit, you might try a different habit that's a more positive, productive habit. Or if it just has to do with your thinking, it could be to just take a moment and think about, why am I thinking this way? Have I really reconsidered or considered everything? And proceed from there into a different way of thinking. Okay? This is a very basic understanding though. So obviously the whole process can be a bit more to it, but the therapist is there to put you into a better frame of mind and improve the situation. Okay, once we've gotten you to understand what skills to implement, then we have the skills, we want to consolidate the skills, and we want to train you into applying them better. And then we want to be able to use the skills in multiple situations, so you don't just have one area that you deal with, so you're going to be ready for many situations. And then finally we're going to do a post-treatment assessment to follow up, which is where we're going to understand what's going on after you've applied all these skills and make sure it's working. And if it is, good. Successful treatment. Thank you.